time for tonight's Sterling Health feature with Travis Sterling of Sterling Physical Therapy, who's contracted with Pella High School for on-site injury evaluations. Tonight's topic is shoulder injuries in football, and specifically shoulder dislocations. Travis, what is a shoulder dislocation, and who are the people and the athletes that are most prone to that?
The shoulder is obviously a really complex joint because we can do multiple movements with it, use it in multiple fashions. So that kind of sets it up for some instability inherently. And so sometimes when a player has the arm outstretched, they get hit unexpectedly, or they have some hyper flexibility or genetic predisposition. The shoulder can kind of shift out of place or in some cases dislocate where it literally comes all the way out.
Football, as everybody knows, is a very fast-paced game, and you're not always thinking. In fact, very oftentimes you're not thinking about exactly what you're doing. How do you go about preventing something like that?
One of the number one things is identifying the type of person that has this problem. It's usually the kid that can do the party tricks by pulling his thumb to his forearm, pulling his shoulder out, quote unquote, for his friends, could touch the floor with his hands very easily. And then from there, trying to prevent it, strengthening, obviously doing specific rotator cuff strengthening in the weight room or with us in the clinic is the biggest thing you can do.
Are there any kind of injuries that could occur from people that continuously or repeatedly dislocate their shoulder?
Yeah, over time you can literally stretch out some of the important ligaments and the joint capsule that helps keep that shoulder stable. Also, there's some other structures in there that if you repeatedly dislocate and hit it over time, you could tear or even break off a piece of bone. Those types of things would have to be fixed surgically.
Are there any braces to help prevent this type of thing?
Yeah, there is a brace that we will utilize with somebody if we do identify it. If you watch the NFL or college football, you'll see a lot of linemen wearing this brace. It'll come out from underneath their pads so you can see that. But really the key is identifying the problem ahead of an injury and then trying to do some strengthening and therapy prior to the athlete going through that because it's very painful and debilitating.
Lots of great information. We'd like to thank our guest on tonight's Sterling Health feature, Travis Sterling with Sterling Physical Therapy, where they provide you with the Sterling standard of care.